Hi, I'm Derek Mahoney. I'm an orthodontist from Sydney, Australia, and for the last 20 years we've been running a very successful mini residency in orthodontics. This program started with a 1-year component which was just theory, and then evolved to a 2-year component which was theory and typodont. Now we're pleased to say it's a 3-year component which has theory, typodont, and most importantly hands-on clinical, which is done in conjunction with my senior instructors. We basically teach in this program 3 fields. One is myofunctional therapy, kids who have a tongue thrust, children who have a crossbite or suck their thumb, people who are tongue-tied. In other words, what do you do early? Then we have the biggest component, which is on orthopedics. So how to expand the jaw, how to protract the maxilla, how to correct a class 2 to minimize the need for surgery. And that's a big passion for me because of my research involving children who have airway problems and their link to malocclusion. So we teach holistically how you can work with your local ear, nose and throat doctor to not only give the kids straight teeth, but to give them an improved airway and better sleep at night time. And the last component of our course is classical orthodontics, how to put brackets on, what wire progression you need, what elastic pattern, how do you case finish properly, what retention do you use. So to teach all of that, you can't possibly do it in a weekend course. So I think a try before you buy, and this will make you really good in orthodontic diagnosis, whether you do orthodontics yourself or not, is our first 2 courses. Course 1 is an introduction into the way we divide malocclusions into 54 different types. Second course goes into more diagnostic criteria, such as how to do an arch form analysis to see whether your child needs expansion or not, how to do a cephalometric analysis to determine the skeletal problem, how to do Bolton's analysis. So the first course is on the 16th and 17th of March. Many people come just to this course to get a bit of a sense of what they would learn and want to then practice. The second course, which is 25th and 26th of May, even though it's called cephalometrics, it's not just cephalometrics, it's a lot more in orthodontic diagnosis and treatment planning. So if you really want to improve your skills in getting the right diagnosis and giving the appropriate treatment plan, that's the way we do it. If you want to learn airway, TMD, facial balance, myofunctional therapy, we incorporate all of this into the program. So if you contact my course coordinator at EODO, Dr. Saskia Aurora, she'll be happy to send you the outline of the whole program. But at the end of the 3 years, you should have completed to a very high standard, and we use the ABO criteria to check that standard. 10 cases, which you can then present towards examination. We offer through UK-based university a grad dip in clinical orthodontics, and we also offer a master's, and it's called an MClinDent. The criteria is very much based on what you want to get out of the 3 years. Remember, this does not qualify you as a specialist at all, but it gives you credits towards applying for a specialist training program. If you want further questions answered, send an email to Saskia. She'll put you in touch with one of the clinical instructors who will spend 30 minutes talking to you, assessing where you are in your career pathway, answering a lot of your questions, etc. So I hope to see the majority of you at least at the first course. Thank you very much for your attention.